Okay, great. Thank you so much for joining today's webinar. This is the second in a series of webinars focused on planning for sustainable financing, specifically to ready you to write the Pandemic Fund Round 2 proposals. Today's focus will be on capacity, risk, and vulnerability assessment. I'll be joined by at least 4 experts, Dr. Raj Sridharan, team lead for the country assessment preparedness at WHO headquarters, and a team from the disaster risk management, Kingsley Bai, and then also Kutsia Huda for questions. And then also our guest from the Food and Agriculture Organization, Dr. Zelamon Tades. My name is Melinda Frost. I work for the WHO headquarters Health Emergencies Program. I'm the unit head for Learning Solutions and Training. So thank you so much for joining today. Throughout today's program, please ask questions. I ask you to put your questions in the Q&A function at the bottom of your screen. Whatever we can't get to today, we will be pulling together into a frequently asked question list and sharing that back out. We'll also share the recording of this webinar, any tools that are mentioned, and the PowerPoint presentations themselves. So with that, maybe I'll just quickly refer to the overall purpose of this webinar series, which is to assist countries in developing successful national plans or proposals on sustainable financing for health emergencies. So the audience are you. I hope that you're all prepared for planning experts, your program manager, proposal writers, grant writers working at national level, potentially with multinationals for the multinational approach. Also, you may be working with your WHO country office counterparts. The specific objectives for this session are to outline how countries can use existing assessments from the International Health Regulations Monitoring and Evaluation Framework to design your objectives and goals, to highlight how countries can leverage the risk assessment process to inform your strategic objectives in your proposals, and to share how countries can embed and integrate a One Health approach across all of the proposal development process. So with that, I'll turn over to the first speaker, Raj. Thanks. Raj, I think you're muted.
Okay. Good morning, good afternoon, good evening to everyone. My name is Raj, and I'm the unit head for the country assessments and planning. And I thought, just to make sure that we're all on the same page as we move forward, I just briefly start with why we're doing a lot of the assessments in the work that we do, and the basis for that. Then talk about the landscape of tools that we have, and then what we've done with the tools, and end with how we use this data for risk-informed planning. So very quickly, and I think many people know that the context of this Ministries of Health regulations.
I'm sorry to interrupt. We cannot hear you very well. Can you please get closer to a microphone?
Is that better?
Yes, much. Thank you very much. Sorry.
Thank you. So, so very briefly, the context for a lot of the work that we do is within the parameters of the International Health Regulations, and the scope of the IHR was basically to not just look at diseases, but to look at all public health threats. So the International Health Regulations is an international legal instrument, and this was something that's legally binding on all 196 states parties. So these are countries that are looking for accountability and transparency within and among each other. Okay. So the purpose of the IHR, again, apologies for repeating things that everyone knows, is to prevent, protect, and control against public health and provide a public health response to the international spread of disease. What this means is that countries need to have adequate systems in place within their country for early detection, containment of possible and adequate response. And part of this is that it's limited to public health risks, and we also want to avoid unnecessary interference with international traffic and trade. So we're looking to stop international spread of disease, but also the impact on travel and trade. And it is an oversimplification. So when we move forward, and we had questions from various partners more recently, where they said, why do we have all of these tools? And part of the reason is that post-EVD in 2014, the recommendations from the review committee asked for a move from exclusive self-evaluation, which was done through the states parties' annual reporting, to approaches that combine self-evaluation and a peer review. And this is where we have the joint external evaluation and the external component of the joint external evaluation. They also asked WHO to support countries for the strategic and operational aspects of the IHR and the engagement of high-level political commitment. So to have that whole of government and multi-sectoral approach were the recommendations from the review committee. And that's the direction that we were moving towards. So part of that meant that we realized that one tool wouldn't do all of it. So as part of that, what we came up with in discussion with member states, technical agencies, including the technical experts in WHO, was a group of tools that we call the IHR Monitoring and Evaluation Framework, which included the mandatory annual reporting to the Assembly, the states parties' annual reporting, the voluntary joint external evaluation that's done every 4 to 5 years, the simulation exercise and after action reviews that took a systems approach to seeing if the system actually functioned better or got better, and all of this under the umbrella of One Health and a multi-sectoral approach. And what we mean by that is that the various ministries and the sectors involved in health were involved in not only the planning, the testing, but also in the response and the sharing of resources to strengthen the national system. So as with the previous slide, I didn't spend too much time on that, but just we've done three versions of each of our tools. So we've actually updated our states parties annual reporting since 2009 twice. We've done the same thing with the joint external evaluation, and we've done the same thing with the National Action Plan strategy. And we made sure that we involve not only the technical sectors inside WHO, but outside, but also with member states and with our regional offices. Okay. So next slide. Okay, so just an overview, because we've been doing this since 2009 with the states parties annual reporting, member states have been reporting annually across 15 technical areas. So we have about 40 indicators across these technical areas. And we use these indicators and these technical areas to report to the Assembly. And you can see the 15 technical areas at the bottom of this, where the bar graph is. And this gives us an indication of how countries are doing within certain capacities. And a lot of this information is what we use with our technical teams to actually not just report to the Assembly, but to also then report back to the country on how they're doing and if there are areas of support that they need. This year, we've had the highest number of countries in the last 15 years that we've had countries reporting. We've had 99% of the countries that have reported using the states parties annual reporting. Okay. Now, the joint external evaluation, as I mentioned, is a voluntary process, and we've done 151 joint external emissions since 2015. Many of the countries, as you see, the number of missions are more than the countries. It's because countries have also asked for a second round of JEs. It's been more than 5 years, so they've done that as well. Okay. So to a large extent, what we do is we use the national action planning to then use the data that we get not only from the SPAR and the JE, but also from other technical teams to develop national action plans. These are risk-informed plans that we develop when requested by the country. And I'll go into a bit more detail with that over here. So we have 3 key steps for the national action planning. One is done in-house, where we actually look at, we do a desk review. And part of that desk review means that we look at national priorities, so what the country prioritizes. We also look at the National Health Sector Plan, country cooperation strategy plans, and any other plans related, assessments or plans that are related to the country. In addition to that, we use all the data from assessments that were done over the past 2 to 3 years. which includes the SPAR, the JE, the bridging workshop data, the One Health operational tools, any information that comes out of simulation access and after action reviews. This is not an exhaustive list, but part of what we're trying to say here is that we try to use all of the data and the plans that are available in the country that the country feels is important to support the desk review that we do in-house with our technical teams and partners to make sure that we have not only the country's priorities identified, but also the context and any regional or global strategies that need to be linked to the National Action Plan. The next step is, and it's done in a relatively old-fashioned Excel sheet where we actually list all the recommendations, we list the capacities, and then we pull out the technical area recommendations of the technical teams. Now, part of what we do with this is, as we work through the desk review, we make sure that we are working very closely with the regional and country office and the Ministry of Health. So if we have questions, we continue that conversation with them. Once this is done, then we also look, and this is where you'll see Dr. Kutsia's name is at the bottom. We try to understand how we contextualize all of these recommendations and all of these gaps within the country, and we prioritize using a risk and say, based on the country's risk, what do we do to move forward? And the images you see on your right are the actual outputs of a risk assessment in a country, and this is what we use when we plan with the countries on prioritizing their risk and then identifying what their short, medium, and longer term plans are. Now, and step 3 is when we actually go to the country and we sit down and then we work through various Excel sheets to then identify and prioritize with the country. I'll use real examples of Sri Lanka, where we were a couple of weeks ago. We sat with 7 or 8 ministries within the country, and we did a 3.5-day workshop where we could actually work our way through these Excel sheets and identify what the short operational plans are, the 1 to 2 year plans are, and what the longer 5-year strategic plan would be. So at the end of this process, we end up with, again, a series of very detailed Excel sheets, as you see on the images. And we also have a tracking mechanism on that Excel sheet to let us know if the plans have started, the activities that were listed in the operational plans have actually begun, or they're stagnating, or they haven't started yet. What we have to the end of this, and I'll close after one more slide, is that we also have an electronic national action plan. And again, Sri Lanka would be the first country to upload their plan to this. And part of this means that the eNAPS allows countries to not only review their plans and update as needed to see if they're on track. So there's a way to track activity level, capacity level, or the whole plan. But it also allows countries, as they work their way through the months and the years, if they have other plans that are important or the country feels need to be uploaded, the eNAPS platform allows them that option to actually upload other plans so that they can make relevant decisions based on that. So the list of plans that I mentioned in my previous slide are just a starting off point. And I think the biggest hurdle, and I think the biggest success for us, is once we put something on paper, then it makes it easier for countries to then move forward with a lot of the work. So our next steps is basically it's basically operationalizing this to not only cost, but look at feasibility studies and resource map what already exists in the country. And the other half is more at a senior policy level, where we try to engage with the senior policymakers in country and within the region to help create an enabling environment for these multi-sectoral approach and implementation of these plans. Thank you. Thanks, Melinda. Sorry if I went a bit over.
No worries. Thanks a lot, Raj. Very, very important. And I'm sure you'll get a lot of questions. So stick around, please. So next, we're going to hear from our colleagues. I think Kingsley Bai will be presenting this, where we're hear a little bit more about leveraging the risk assessment process in order to inform your prioritization. Thanks, Kingsley.
Thank you. Share my slides. Thank you. Good morning, afternoon, evening, depending on where you are. So I am just going to be talking about assessing risk and using that to manage also the risk process. So I'm going to start looking at some of the concepts that's behind risk assessments, and that will set the tone for the rest of the presentation. So what is hazard? So hazard is referring to a process phenomenon that's causing negative impact on health, and not just on health. There are other factors that are also mentioned in this definition. So I just put some examples here, like you saw floods, cyclones, earthquakes. We have different classes of hazards: biological, hydrometeorological, which will refer to the floods and cyclones; geophysical hazards, including earthquake; and then sometimes societal hazards like conflicts, but there are more. And then the other parameter to describe here is vulnerability. That's looking at the conditions of not just people, again, but also other infrastructure conditions that increases susceptibility to the impact of the hazard. So here, again, some examples in the box, gender, age, disability, health status, migration. So there are still lots of factors that could increase the susceptibility of people to the risk. And the last, but not the last one parameter on this slide is the exposure. Exposure is actually looking at the situation of people. I think I want to describe exposure as the proximity of whether it's people or infrastructure to that risk. So we are also looking at the location of that population. Where is that infrastructure located? Number of people that are living in that area. The interaction between the hazards, the vulnerability, exposure, that would then result in some of these consequences. So the potential consequences, loss of life, livelihood, and health that constitute the risk. So risk is not necessarily hazard, but it is an interaction between hazard, vulnerability, exposure. Next slide. So the next. So the last piece of the puzzle is capacity. When we develop our capacity, we bring down the risk. So the capacity is a combination of the strengths, attribute, resources available within that system to help to reduce risk and strengthen your resilience. So we also have some examples of capacities that we have highlighted here. One thing we would like to highlight in this slide is that while there are some capacities that will address each of these parameters, whether it's hazard, vulnerability, or exposure, to reduce that and having an impact on risk, many of the capacities are cross-cutting. They could also, like surveillance, will affect exposure, vulnerability, and hazards. And many capacities are also cross-cutting at the level of the hazard. So you have hazards that one capacity addressing multiple hazards. And that is the science behind risk assessment. When we do risk assessment, we're able to identify these capacities, understand where our vulnerabilities are, so we can begin to shape our planning processes. Next slide. So for this slide, I just would like to share with us some of the connections between risk assessment and the IHR monitoring and evaluation framework and some of the global developmental agenda. So you agree with me that whether it's the international health regulations that's looking at strengthening global health security, or Sendai framework that's looking at disaster risk reduction, or the Paris Agreement on climate, name them. All of them, they have a common theme, and that common theme is that they're helping to reduce risk, protecting lives, livelihoods, and health. And these are the things that we described already when we're looking at these definitions. So all of them have that component. So what we have in the health sector is a health emergency and disaster risk management framework developed by WHO. What it does is to bring all the health actions from this global developmental agenda and align it with the international health regulations. I think Kutia, when after the presentation, we'll shed more light on this. But then we have so many risk assessment tools, but today we're going to focus on the strategic risk assessment tool refer to as STAR. Some people are familiar with STAR already. So STAR is derived from the Health Emergency and Disaster Risk Management framework. So it's closely aligned with the international health regulations, and it's informing planning processes like NAPS. So next slide. Here again is just have a description of what is STAR, Strategic Risk Assessment, the whole hazard country risk profile. It's a comprehensive all hazard approach that helps countries to rapidly conduct a strategic evidence-based assessment of their health risk. It uses a stepwise approach. So countries, multi-sectorial participants in a workshop setting use this tool to identify the hazards they face, describe the likelihood, the seasonality, and also the impact of that hazard. With all that information, they develop the country risk profile. And with this country risk profile, it can inform planning processes like NAPs, like business continuity planning, and also can trigger some readiness actions, identify potential health emergencies before they happen. And I think we can see it in some other slides to come. Next slide. So why develop the country risk profile? I think Raj showed these three outcomes of the STAR in his presentation as well. So the first output of STAR that I would like to present here is the 5x5 risk matrix. So that prioritizes all the risk. It plots the likelihoods and the impact of risk. If you look at this image on the left, you see that for some hazards, they are very likely to occur, almost certain, and they also have very high impact. So countries who want to prioritize hazards are in that region because resources are limited. But sometimes, again, you have very high impact hazards, but unlikely to happen. In some contexts, one example, we earthquake. Earthquake will have high impact, but unlikely to happen. But countries will also want to prepare. So this helps countries to prioritize their investments in planning processes. The next one is the seasonal calendar of risk. This is showing the period of likely occurrence. So we have months from January to December, and where you see red is where you're most likely for that hazard to occur, and then the green is indicated by where you're least likely. So you say green to red color scale. But this is very helpful because people can anticipate risk before they occur. You can't say, oh, in the next 3 months we're going to have missiles in this geographical area, and then you can begin to trigger some early actions, prepositioning supplies, and commencing top immunization. And then the last one is also this next actions, recommendations, priority actions that are drafted by the multi-sectorial participants in the workshop. These actions are linked informing the NAPS planning process, like Raj mentioned as well. So they're also very important. But the country risk profile is not carved in stone. Once you have developed the country risk profile, information on emerging risk like ENZO, heat wave can always be linked at any time to the risk profile. Next slide. Yes, for this slide, I wouldn't want to take much of time because should share here is that we'll show where risk assessment and evaluation framework. Next. So here again, we have developed the country risk profile using the country risk profile for risk-informed actions. So how is this informing the IHR monitoring and evaluation, like the NAPS planning processes in country? So health consequences that you have derived from the STAR and drafted can be consolidated to inform planning. And again, we started with NAPS and other IHR monitoring and evaluation frameworks, but it can also potentially inform other planning processes in country, like humanitarian response plan and all that we have on the list. And then the information that is being gathered during the risk assessments can also be used and referenced during other risk assessments. In fact, some of the findings from that risk assessment, the strategic risk assessments, can inform, so people can do a deep dive in countries, want to do further risk assessment. Oh, okay, there is a risk coming up. Can we start planning for a rapid risk assessment? So these risk assessment processes are interrelated, they are connected. And then the country risk profile can also now be used, linked to the EOC framework, which we are already working on at the global level and even in some regions. And this can help to trigger early warning actions. And I will explain that later in the presentation. Next slide. So here are some highlights of some of the data from STAR that STAR has been implemented in 100. We have had 142 STAR exercises conducted in multiple country contexts. So we have subnational, national, and district, even community levels are being done. So 96 member states have done at least one STAR exercise. And we have had STAR in all the 6 WHO regions have done at least one STAR exercise. As you can see on the left side of the screen, you see some of the participating agencies, because this strategic risk assessment is a multi-sectorial driven process. So we have Prime Minister's Office represented, and this is to a high level and very important. We also have disaster management agencies, that's beyond health, that's participating in all these that I've listed, including NGOs, academia, UN partners that are involved in drafting, conducting the strategic risk assessment. Next slide. Next slide, please. So here, I think this is my last slide, just showing some of the examples from STAR, where STAR is a very flexible approach and has been adapted to different contexts, like climate change risk assessment that's just completed last year in Sweden. We also had this infectious hazard assessment in Bangladesh during the COVID-19 pandemic. It's been adapted for strategic health risk assessment in health facilities in the PAHO region that has been published. And then also humanitarian situation, small island developing states. And also at subnational district, STAR is ongoing currently in Uganda, and we've had at community level in Nicaragua. So I was happy to also hear that STAR, the risk country risk profile, was used to inform the just concluded NAPS in Sri Lanka. And we have AFRO also working on the disaster risk calendar to inform early warning and early action. So thank you all for listening. Kusia will be standing by with me to respond to some of your questions. Thank you. Over.
Great. Thanks a lot, Kingsley. And in fact, I think we're just going to take a quick break and maybe go to some of the questions right now, just to break things up a little bit. So if you want to hold on, please, maybe just one quick question. I think we can stop sharing the slides just for a few minutes, and then and we'll go to a couple questions for Kingsley and Kutsia and Raj. So I think Kutsia and Kingsley, for you, you mentioned a lot of different assessments and documents, but what additional assessments or resources on risk profiling should be considered to help inform country proposals beyond just the ones that you had mentioned? Because I know there are a number of different tools and products that your team works on.
Thank you very much, Melinda. Thank you to the previous presenters as well. This question is quite pertinent, and we often are being asked by countries, by our partners, and many disaster and emergency managers across the board. I think that most important bit is like, this is a WHO process that what Raj and Kingsley have presented, and then supporting the countries to come up with some assessment and also some elements to fit into the planning process, particularly for pandemic preparedness planning. So in addition to that, at the national level, national health policy, national health strategies, national disaster risk management plan, national health plan, then national hazard response plan, country donor profile, country's development plan from the national side, country side, this would be very, very instrumental to fit into the planning process. And apart from that, the other planning process coming through the UN mechanism, one of the main document there is common country analysis, which is also matching with the WHO's country cooperation strategy. And then on top of it, there are like a couple of other assessments and like climate change risk assessment, climate change adaptation analysis, joint analysis of interconnected risk and humanitarian program, humanitarian response plans, And then risk analysis for humanitarian planning cycle. These are the information and donors profile of the countries. Anything related to the second slide that we have shown, the exposure, hazards, and vulnerabilities would be very instrumental in fit into the preparedness planning for pandemic or any other emergencies and disasters in the country. Thank you, and back to you.
Great. Thanks a lot, Kutsia. I'll go to one question for Raj, and then we'll return to Zahlam for an overview on One Health approaches. So Raj, how can countries choose the appropriate tool that can be adapted to evaluate capacity, risk, and vulnerability assessments?
Okay. So we have a few tools available. One of them is the data that countries give us through the States Parties annual reporting. And I think as we've seen, almost all countries respond using this data. And just to answer a question that I just saw is that the States Parties annual reporting is the official reporting of a sovereign nation to the Health Assembly. So we always have to consider both the political and technical aspects of this when countries respond to this questionnaire. Having said that, we can use that data to identify areas where countries have not made progress in, and actually proactively reach out to countries to see how a technical unit could support the technical area of the lab, for instance. For the system approach, we rely heavily on our colleagues that do simulation exercises and after-action reviews. So post-outbreak, running an after-action review to see what worked, what didn't work, what updates need to be done is the best way of actually looking at to see if the system actually functions. I hope that helped.
Great, thank you. Yeah, I think it probably did. Thanks a lot, Raj. Okay, great. Now we're going to return to our colleague, Zahlam Tadessa, sorry, from the Food and Agriculture Organization to hear about One Health approaches. Zahlam?
Yeah, thank you very much for giving FAO the opportunity to speak in this forum. I would like to start really by giving some context as to why the animal health sector is important for establishing an effective capacity for pandemic PPR. Next, please. Yeah, we really believe that strong and capable animal health sector and system is an important ingredient for achieving effective national health security and pandemic PPR. Next, please. Why is the animal health sector so important to effective pandemic PPR? Because a strong and capable animal health sector enables to early detect the emergence and spillover of zoonotic pathogens from animal source. It also helps us to effectively prevent and mitigate the risk and transmission of zoonotic diseases and MR from the animal source. Therefore, the animal health sector and multi-sectoral approach indeed are important contributors towards establishing a robust pandemic PPR capacities. Next, please. Now, what is FAO's approach indeed to sort of strategize and help strengthen core capacities of the animal health sector? As you know, first, we support assessments and landscaping of core animal health capacities through participating in various standardized capacity evaluations, such as PVS and JA evaluations, as well as other sector-specific assessments and evaluations, including multi-sectoral evaluation tools such as GRA. And second, using these findings of such assessments, we also support and participate in the formulation of national strategies, action plans, investment plans in line with those findings of the assessment. Some examples, disease-specific strategies and action plans, mostly zoonotic diseases, AMR NAP, and also national food safety strategies, NAPs, and also national One Health action plans or strategies. Now, in addition, FAO also supports us to develop and implement programs, initiatives, projects that aim at improving animal health core capacities based on the gaps identified through such assessments, and evaluations. Of course, in line with our mandate, we support members to improve the core capacities of various technical areas, particularly focusing on AMR, food safety, zoonotic diseases, biosafety, biosecurity, national lab systems, reporting, workforce development, and other relevant technical areas. Now, moving on to the next slide, please. What is our practical approach that we need to take to integrate the animal health sector interventions into pandemic fund proposals? As you know, the aim of the pandemic fund, especially in the context of the animal health sector, is to improve the capacity and capability of the animal health sector to be able to early detect the emergence and mitigation of pandemic threats at the animal source. Now, how can we improve the capacity and capability of the animal health sector? We think that it is through improving the core capacity levels of target previous critical competencies, as well as J indicators to demonstrated capacity levels in line with the pandemic fund results framework under the three technical areas, namely surveillance, lab systems, and workforce development. Now, in doing so, the approach that needs to be taken from FAO's perspective is depending on the country's current level for each target core capacity indicator, we need to identify interventions that enable the country's animal health system to progress to demonstrated capacity levels. Now, we have also supported development of J milestone library for the animal health sector. Therefore, we recommend that countries make use of and make reference to this library to facilitate the identification of activities that will enable countries to achieve demonstrated level of capacity through pandemic fund projects. Next, please. Here, I just want to highlight the expected achievements of the animal health sector through the pandemic fund projects. We believe that through the pandemic fund support, we envision to establish an effective and robust animal health system with capacity and capability to timely gather and swiftly track information on disease events through establishing a sensitive passive surveillance system. We also envision to safely collect, to build capacity for safe collection and shipment of biological samples from animals, to test these samples accurately and timely, and also to conduct genomic characterization of detected pathogens using national capacities, and also to timely share information and data regarding priority zoonotic pathogens and AMR in animals in compliance with national frameworks and strategies. I think I've concluded my presentation, and I would like to thank you for listening. Over, thanks.
Great. Thanks a lot. That was a wonderful presentation. So right off the bat, we do have a question for you, Zahalam. And what we learned from our first webinar that was held on Tuesday is that we're aware that ownership, commitment, coordination, collaboration, and co-creation is 15% of the evaluation for the second round of the pandemic fund proposals. How can countries better engage and coordinate with the animal sector in the development of the proposals?
Yeah, thanks a lot, Melinda, for this. Yeah, I think our experience from the first round call is that really we have been advising and also guiding our teams at country offices to really actively engage with their counterparts in WHO and we other implementing entities to come together and identify and strategize to sort of come up with multi-sectoral proposal, of course, taking into account the priorities and needs of the countries, both in the animal health sector and also the public health sector. I think that has yielded results in the first call, and we would like to really continue such approach that both sectors at country level need to work together and work with their respective line ministries, particularly the ministry in charge of animal health and also public health, and sort of have a continuous consultation process and use these tools and findings of assessments to guide the identification of relevant interventions that really make a difference in progressing countries' core capacities to the expected demonstrated level of capacity level 4 and 5, in line with the J framework.
Great.
I don't know if I have responded adequately to your question, but happy to continue.
Thank you. I think you did, and I'll just invite the participants, if you have additional questions or would like further clarification, please enter your questions and concerns in the Q&A function, and we'll be pulling them out of that. Please don't raise your hand. We won't go to you live. We would prefer that you enter your questions in the Q&A function. That allows us to take them and then answer them later if we're not able to get to it in today's session. Thank you so much, Zahalam. So the next question we have is for countries that have an outdated NAPS or no NAPS at all, and maybe a similar question for JEE, outdated or none at all. What additional sources and countries could be considered to inform the capacity, risk, and vulnerability assessment selection? Raj, I believe this one is probably for you.
So no, thank you. It's a very pertinent question, and so as I showed very briefly in this bar, all countries, and we've always had a response rate of over 85% from the 194 countries that actually respond to the annual reporting. So there are very few countries, actually, I can't think of any, that have no data available to us. There are 2 countries that didn't respond this year, but for those 2 countries, we have data from last year or the year before that. So there's always data through the SPAR. But if we ignore the states parties annual reporting completely, ideally, we can look at running a simulation exercise to make sure that there is multi-sectoral engagement for a known threat. So if we say that this country's got floods, or it has cholera seasonally every year, we can run a simulation exercise and say, for cholera, how are the first cases detected? What ministries are involved? How do we set up CTCs? How do we engage with the other sectors, the private sector? How do we do our comms messaging to the hospitals, to the schools, to our families well before rainy season starts? So part of this means that we never have our hands tied. And the last case is we can just pick up the phone and talk to the Ministry of Health. And I think that's part of the advantage that WHO has, is where we don't have to rely just on data that come through questionnaires. We have 152, 156 country offices. We have strong country office presence, we have regional presence, and we have global technical teams here. And if nothing works, then we can call a technical meeting, because we have the convening capacity as well to actually bring the smartest people in the world together around a table and ask them questions on how we deal with stuff. So I think inaction would be a fault, but I don't think we have any reason not to be able to support countries. Over.
Thanks a lot, Raj. Let's see. I think the next question is for Zahalam. Would you suggest having a dedicated section for the One Health approach within proposals, or have it be more of a cross-cutting approach in terms of the proposal goals, objectives, and activities?
Yeah, thanks for this question as well. I think, multi-sectoral proposal entails really having a component into the proposals that really addresses or build the capacity of both animal health sector and public health sector. I think, integrating animal health related interventions implies really multi-sectoral proposal. So there is in the template of the proposal, there is a part whereby animal health interventions, multi-sectoral interventions can be integrated for under each technical area, surveillance, lab systems, and workforce development. And I think we can also include, improvements in terms of the One Health coordination and governance system in the country, depending on the context of the country, such as establishment of multi-sectoral platforms, and also strengthen if there are already existing platforms in the country. But the focus here is really to build capacities related to lab systems, surveillance, and also workforce development related to the animal health sector, in line with, along with the public health sector. So I think there are provisions and sections where this can be included in the proposal. Thank you. Over.
Great, thanks a lot. Let's see, let me go to Kutsia and Kingsley, I think, for this question. Those conducting the assessments in developing countries often lack high quality long-term data in their health and epidemiology over the years. They have few existing local studies to reference. What can be done in such situations?
I think that I'm a bit surprised to know that the reference is made only to the developing countries, because it may happen, like, emergency and disaster data across the board is not something like, readily available in many instances. But that should not stop the process. That's the reason where the quantitative data is not available, we can go for the qualitative data. And qualitative data is often we can find by interviews, by focus group discussion. That's the reason if you look at the strategic risk assessment methodology, the whole methodology is designed as such that the lack of data should not stop the process to generate at least a baseline something. So because we can always do the development and there is no end to development. So it's important to have some data which are valid and which has got consensus from all the stakeholders who will be engaging themselves in the process of developing capacity or reducing the risk. It would be always better to do that and take that path instead of just wandering around that it is not there. So at one point of time, we really need to get into this the process of getting the data, and then to try to improve our system where we get stuck, that data are not available from the previous time.
And just to reiterate to what Kutsia just mentioned, beyond having the available evidence, we have multi-sectoral experts with vast knowledge of the subject matter, and so that is something that can be referenced and used during the STAR workshop. You can expertise and their knowledge to inform the strategic risk assessment. So yes, data gathering, evidence gathering is very good because the process is really evidence-based, but when data is lacking, you have to, like Kutsia mentioned, harness all the resources that's available, including experts' opinion and their knowledge of the system to do their assessment. Over.
Okay, great. Thanks, Kutsia. Thanks, Kingsley. So the next question, I'm actually going to go back right to Kutsia again. One of the individuals, the participants today, has asked about the infodemic risk assessment. What do you think about that?
It is an excellent question, actually, because this is, that during the pandemic time, the reason this attention was given from the organizational side to this infodemic management, it's a new spectrum of work because it was very important. And if you get back to the presentation that Kingsley did today, we linked this risk communication to the exposure. And this is where the infodemic risk assessment is very, very crucial. Because if the community population at different level, if they're not aware about their risk or they are being misinformed, that has severe consequences on the impact and consequence as well. So that's why it's very, very important to look at the infodemic risk assessment and then take into consideration the level of actions and the priority actions that can reduce such infodemic problem in the countries and communities. Thank you, and back to you.
Great, thanks, Kutsia. And I think probably most people know this, but in your joint external evaluation, those areas have been brought together within risk communication and community engagement, in case you're looking for the resting spot for that. Okay, so I have one more question. Well, it's actually a series of questions. I believe most of these are going to Raj, but let's see. So it's good to see that overall SPAR reporting has gone up over the years. But in this context, when countries sort of self-evaluate, sometimes there can be an aspect of bias. So what are the strategies adopted to address this bias? What can countries, or what should they do when they don't have these recent ratings, or they're on the lower side? And what can countries do to show progress? Maybe
Thanks.
Raj and
I
Kutsia.
will. Thank you. As I mentioned earlier, these are sovereign nations reporting to the Assembly. So there's always the political and technical consideration to be acknowledged. So countries will report what they want to, some technical, some political, and it's a mix of both, which is completely fine because we don't police countries. What we do look at is the reason why we standardize the SPAR across these 15 technical areas was so that it would make it easier for countries to report to the Assembly, but from our end, it would make it easier for us to also report back to the countries. Pre-2009, they were just narrative reports that were acknowledged, but we couldn't actually report back because the formats were different. What we're trying to do now is to say, if a country, for example, says they're fantastic across the board, it's great. We don't question that. We just move forward, but we also say, can we document your best practices to see how you've achieved this high score and how you maintain this high score? And then this is where we try to see if we can document best practices, because assessments are not all about identifying gaps. It's also to identify best practices, so we can use that and use that as recommendations for other countries. So we can always say, and if we identify, countries usually identify certain gaps, that's usually something that they want to prioritize. So we follow up with countries to identify the low scores and say, for RCC, for example, if there are scores that are relatively low, then we reach out to the technical team within the RCCE group and say, what can we do with the list, these 9 countries and 3 regions that all seem to show the same gap? What can we do technically? Is there an elegant solution that we can come up with through a training or through developing SOPs that can actually resolve this issue? So we'd like to use whatever data we get to support countries or document best practices. Over.
Great, thanks a lot. And I'd like to go back to you, Salam, to comment on that from FAO's perspective, and also recognize the fact that the series, while currently being hosted by WHO, is across the UN partners that are contributing to be implementing entities in the pandemic fund. Zahalam, do you have any comments around that same area, how countries can really show improvement, or if there's been gaps, how to address that through the pandemic fund applications?
Yeah, thanks a lot for this question as well. I think we are going to really, in the process of developing the M&E framework for the pandemic fund, and it's our expectation that existing evaluation tools may be used to really see how much impact has been achieved through pandemic fund projects, through undertaking periodical JE and PVS evaluations, using the existing capacity as a baseline, then, assess, few years down the line after project implementation to see if there has been any progress in terms of capacity improvements. We will be depending on PVS tool and also JE for, issues and technical areas that are really multi-sectoral. Yeah, over back, thanks.
Okay, great. Thanks a lot. And with that, I'd really like to thank our different presenters today, Raj, Kingsley, Kutsia, and Zahalam for joining us in this important webinar. We wanted to suggest some additional resources. I believe my colleagues are probably pasting these links into the chat right now for easier access, although you will have access to these slides following today's webinar. And then also we just wanted to reiterate that this is one among a series of different webinars that walks country level individuals through the pandemic fund writing process. So very much structured, step 1, step 2, and so on. You'll see that the week of April 9th through the 12th, we're really focusing on the technical areas that need to be reflected or should be reflected in the pandemic fund proposals. Then that would be lab and surveillance, the health workforce, cross-cutting areas that reflect gender and so on, and also a focus session with our implementing entities. And then you can see other sessions through April that will really help you complete your pandemic fund proposal. And then we'll go to the very last slide. So thank you very much for taking your time to join us today. If you have any additional questions, again, we'll be taking the questions that were posed today and put in the question and answer section in the Zoom space and pulling those into a frequently asked question list to share out following today's webinar. If you have additional questions, we invite you to email those to whespp@who.int. I'll repeat that, whespp@who.int. And please send us some feedback. Take your phones right now, take a picture of that QR code and let us know what you think and how we can improve as we move forward with this series. Thanks so much for your time today.
Okay.